and welcome to Legal Affairs. My name is Diamond Liddy, and I'm the public defender for the 19th Judicial Circuit. We have a great show today. We're going to be talking about health and the health department. And we are very lucky to have the head poobah, the administrator for the St. Lucie County Health Department with us, Clint Sperber. How are you, Clint?
I'm doing very well, thank you.
Great. And with him, and we've got to define this for our viewers here in a minute, Caitlin Farkas.
Yes.
Who is an epidemiologist, right?
Yes.
And what in the world, Caitlin, is an epidemiologist?
So I work within the epidemiology program. We do disease surveillance and disease investigation. So epidemiology is just a fancy word for tracking and following disease and trends and things like that.
Oh, I gotcha. Okay. Let's go back for a moment. Let's start with you, Clint. How long have you been with the health department?
I've been working for Department of Health for approximately 20 years.
Wow.
It goes by quick.
Oh, yeah, I know
seem
about
like
that.
it.
Yeah. Here in St. Lucie County?
I started out actually in Indian River County, and then I transferred over to St. Lucie County. So actually my background starting with Department of Health was in disaster work. So it was shortly after 9/11, and then right after 9/11 when the anthrax attacks happened at the Senate Hart Building in Washington,
Right.
and the AMI building in Boca Raton, that funding became available through Centers for Disease Control for disaster preparedness planners in public health. And that's really where I started and kind of grew in that realm
Okay.
in emergency management, originally in Broward and then through Department of Health, and have grown over the years to my current position as the administrator.
Okay, now do you have to be a doctor to do what you do? What credentials do you have to have? Because it's a big deal.
So my current role, you do not have to be a physician. It's actually an agreement between the county commission and the state of Florida Department of Health. So my position, it's appointed by the state surgeon general, and then it is approved by the Board of County Commissioners.
Oh,
so
I see, okay.
67 counties, 67
Sure.
county health department administrators or health officers. So depending upon the county needs, in some counties, they do want a physician in the role. Other
Right.
counties, it's not as necessary.
Okay.
And I'd say one of the main reasons why is through Department of Health, we are a state integrated system.
Okay.
We have approximately 14,000 employees statewide, so we have a lot of expertise
Wow.
at our state office and then all around the state in different areas. So it's
So you're
helpful.
paid and funded by the state, or state and county, or how does that work?
We're state employees. The way we receive our funding, we do receive federal funding, state funding, and then through a core contract that we sign through the Department of Health and the Board of County Commissioners, it outlines roles and responsibilities, and we work on funding with the county commission.
Oh, I gotcha. Okay. So what degree do you have, or degrees? I mean, what is...
My background, I have a degree in criminal justice.
Right.
And then also in public administration.
Oh,
So
I see.
Earned a
Okay.
master's in public administration.
Gotcha.
So what I tell people, my knowledge gap is about a mile wide and an inch thick.
Yeah.
I know a lot about everything, but with other things, when we start talking about diseases,
Right.
we need to have the Caitlins
Yeah.
who work with us,
The
who specialize
epidemiologist,
in it.
which I'm going to use that word a lot today.
Yeah.
Caitlin, what about your background?
So my background, I went to local school, Palm Beach Atlantic University, and I studied pre-med and biology there. So what happened is I actually worked in research after graduating and took some time to travel with my husband to out of the country where he worked in aquaculture. And then when we did come back, I began working with the health department. I've been here just over 3 years.
With St. Lucie County?
Yes, with St. Lucie County.
Okay. We know now what an epidemiologist, the definition, but what do you do for the local county health department?
So locally, we are responsible for the reportable diseases and conditions in the state of Florida. So when an individual does become infected with one of these diseases, it is reported to the county health department. It is required to be reported to the county health department. So what we do is we receive that positive lab result, let's say, and we follow up with the provider, whether it's a hospital, whether it's a doctor's office or an urgent care, and we find out more information. We find out what type of symptoms were they having. We find out, is it identified with any other larger scale, possibly an outbreak we're following or something like that.
I gotcha.
So we keep track of all of the reportable diseases. We follow up, we investigate, we interview, and then we ultimately provide education, because when we talk about communicable diseases, it means they're able to be spread from person to person.
Right,
So we
right.
want to make sure that people have the education they need in order to not spread this
Spread
to
it
family
further,
members,
right.
to coworkers, things like that.
Okay.
So by law, how she spoke about reportable diseases, by
Right.
law, physicians and laboratories, if it's something is laboratory confirmed, that individual from the lab or provider, they're required by law to report it to us at the health department or
Yes.
any
Oh.
county health department.
Oh, okay.
And there are approximately 75 different diseases that are reportable diseases. So I'd say on a yearly average, there could be 2,000 calls that we would have to investigate and follow up on.
Now, when you say investigate, what do you mean? You go out there with a...
We receive a phone call that comes through a medical provider, or if we receive
That
lab
says- and-
results,
and I don't
we
know-
need a follow-up on it. So it's initially a follow-up, a call, we need to confirm it, and that would start the investigation. So whether it is a
Okay.
5, 10, 15-minute call, or it could be a very detailed investigation.
Okay, but I mean, investigation, you bring in the person, or you go out to meet the person, or what?
Yes, yes, and yes.
Yes.
Oh,
yeah,
okay.
It just depends upon what it is.
Okay. Now, let's throw out syphilis. Okay, is that one of these enumerated
Yes.
diseases? Okay.
So we actually have a different department, our STD, our sexually transmitted disease department,
Okay.
that works on well, they work with gonorrhea and syphilis and chlamydia. So that's really what their focus is. And
Okay.
we also have an HIV department, which is another
Locally?
reportable- Yeah.
Okay, okay.
So at the health department, we have approximately 170 full-time employees in 4 different locations. And
And you oversee all of them?
yeah, so it's a day-to-day operation. So my role, it's the day-to-day operation of
Okay.
the local county health department. And there's obviously, people who are in different roles to oversee, some of the work or a
Sure,
lot of
sure.
that work.
But let me stop you there.
Sure.
Now, you're saying there's 4 locations in St. Lucie County or on the Treasure Coast?
In St. Lucie County.
Whoa. So I had no idea, and we talked about this earlier
Yeah.
before we started the show. You folks are...
We do a lot.
Yeah, and that's a I don't think people know that, which is and we're going to get to how you can go to the health department, why you can go to the health department, all those kinds of things in a minute. But wow, so you have 140 employees.
About 170 full-time.
It's 170. Wow. Okay. So, who do you serve? Or do you have to be indigent to go to the health department?
That's a great question. If I was giving a presentation on what we do, I would usually start out saying that we get involved in everything from birth to death and everything in between. We have a vital records office that you can get birth and death certificates. We have
Right.
programs where we deal with mothers before they want to be pregnant. I mean, we have programs with kids all the way up to adults. So it's not based upon your financial eligibility and with some of the things that we do. I mean, from
Okay.
a clinic operation, we do provide we do provide adult care, minimal adult care, but,
Right.
but we do have a clinic at our main office right off of Midway
Okay.
at our Mineral location. So that is 5 days a week where we do have a nurse practitioner, sometimes 2, who help out, and we treat adults typically with chronic conditions.
Wow.
We have family planning. We do
And that
immunizations.
they don't. Okay, and they don't have to be indigent.
Correct.
See, most people.
Misconception.
Yeah, that's a
Yeah.
huge misconception.
We have a huge dental program. So our 4 locations, we have a location in Fort Pierce, right off of 7th Street and Avenue C.
Right.
The old logistics center off US 1.
Okay.
We rent space right in St.
So
Lucie
is the
West.
hands clinic under you?
No, but that's an interesting conversation. Actually, when HANDS was started, it was based upon funding that we received through our Department of Health. Actually, it's through the federal government. It
Right.
was a grant called the Low Income Pool Grant, or LIP grant.
Right,
Where
right.
we put up our funding, our primary care funding, approximately $400,000, and in return, we received about $1 million.
Okay.
So with that money, when it first started, it came back down to us. We put our $400,000 back into our primary care so we can still run our day-to-day clinic operations, but a majority of that other money was used to fund the HANDS clinic.
Oh, I got.
So
okay.
for the first 5 years, when the LIP funding was available, that's what was used.
Okay, but then that changed, and then they had to get funded elsewhere. Which,
Correct.
Okay.
Correct.
And I'm sorry, you said Avenue C, Midway.
Midway, right down the street from where we are right now,
Right.
in St. Lucie West, we have our pediatric dental program that we call Forever Smiles. It's a really nice clinic operation where we have 7 operatories, so 7 different rooms where we take care of kids. And that's filled up daily, and we're always looking for more kids. And we have a Women, Infant, and Children, or WIC program that's at that location
Right,
as well.
right. Wow. That, I mean, people do not know that. And now, of course, the school, and you can answer this, Caitlin, I don't mean to leave you out. It just, we got on a roll here.
No, it's okay.
School children, if they can, does the school system know about this? Are the teachers aware they can refer a child if they think they have an illness or they need dental care or whatever to the department?
Yes, and we do have a school health program with school health nurses that are within our schools. Each nurse has usually 2 to 3 to 4 schools that are under them, and they work closely with the health paras that are employees of the school district. So we receive weekly reports of potential illness, clinic visits, any maybe clusters of illness they might see. So maybe, 1 or 2 children throughout the school might have, let's say, the flu. And we work with them to see if we can identify any commonalities. Are they in the same classroom? Do they share the same bus? Are they
Right.
potentially siblings and they got sick from each other at home? So we do work very closely, our school health, with the local schools.
So I guess in a very real sense, your health department not only provides health services to the community, whether indigent or not, but you're kind of like a watchdog to get control of diseases, et cetera, correct?
Yes, correct.
Wow.
Our mission is to improve the overall health of St. Lucie County.
Okay.
And it's broken
And-
up, a little bit more detail, and we do that with partnerships. Whether it's your office as a public defender,
Right.
we work extremely closely with the school district on many different areas. Board of County Commissioners, the municipalities, funding agencies, whether it's United Way or Children's Services Councils. We work very close with all 3 law enforcement agencies, the fire
Wow.
district,
Yeah.
housing authority. I mean, there's really a lot of non-for-profits, faith-based. I mean, there's a lot that we do with our mission, which is very overarching, to improve the overall health of 320,000 plus people.
Yeah.
It's very far-reaching. Our scope is very broad, and there's a
Obviously.
lot that we really get involved in, and especially with the hospitals.
Yes.
Well, now, Caitlin, as an epidemiologist, so let's say the school district, Longwood Elementary or what one of the schools calls the health department and says, I think, you know, we've got 2 children here with chicken pox or something, or mumps, or, you know, things that, I don't know, do kids still get chicken pox and mumps?
So let me start out that answer. And then I'll let her. So one of the things that is really important for us to prevent diseases, and actually it's a great question because those are what we would call vaccine preventable diseases.
Right, okay.
And what we would strongly encourage, and we need to because we have seen disease come back
Right.
across the country, diseases like mumps and measles that you really don't hear about anymore because it is a vaccine preventable disease, but is, you know, sometimes we see kids who are not vaccinated for
Right.
one reason or another, and as long as they're vaccinated, they have full protection
Right.
or close to full protection. And so to answer your question, with chickenpox or with mumps, we do have 9 school health nurses to cover all 40 different schools. And Caitlin mentioned, depending upon, some will have more schools than others. It is a relationship that we have closely with the school district, with the health area of the school. So
Right.
we work closely with the clinics and then with the principals and all the way up to.
Well, and how does it work, you know, actually, how do you all sit around a table and say, oh my goodness, we got mumps here, we got, you know, let's devise a plan to get a hold of this to minimize the impact, or how is that what you do, or?
So there are parts of, okay, so in order to go into school, there are requirements as far as vaccines that are required to
so
have.
you have to have chickenpox, so that I shouldn't even talk about that. Okay.
So there's a list of vaccines that you are required to have.
Right.
But if we walk through your scenario, somebody goes to school, they're ill, they go to the clinic. What we would be able to do is learn more about that. The clinic would follow up with one of our school health nurses if they're not currently on site.
I got you.
Depending
Okay.
upon what it was, then it could get elevated.
Right.
Potentially could get elevated to us as our public health role if it is a disease where we do need to learn a little bit more about. Common
Well-
cold stuff we don't really get too involved in.
Well, and you folks, I have to say this, we won't talk about it in too much detail, but I know hepatitis A was an issue.
And still is.
And still
Yes,
is.
it is.
And the health department got on top of that, were proactive. All of you, you know, did vaccinations to our office, at the courthouse, you know, to the community, and did an all-out effort to minimize the risk of that. And thank you. I mean, you know.
Well, it's a very serious virus and disease. And last year, when we really have seen an uptick of cases across the country and here in Florida, our state surgeon general, Dr. Vickies, when he declared a public health emergency, that really helped us outline our authority and responsibility to address it. So what we're doing here in St. Lucie County, every other county in Florida has been doing.
Right.
Because on a yearly average, prior to last year, we would have 1 or 2 cases of hepatitis A. And last year we had 53 cases.
Right.
And we still have more cases. And, you know, with that, I can let Caitlin speak a little bit about
Sure.
or a lot of it.
So yes, as Clint mentioned, hepatitis A is still very much something that we want to make sure that we get our vaccine, make sure that we're following up. I'm just one member of our epidemiology team. We have our supervisor and we have others that work in our department. So it's great when we do have anything that does become elevated, as you mentioned, because we have a team where we can come together and it's not just
and
one
brainstorm
person.
and
Brainstorm and, you know, take experience from a different scenario we worked on or a different disease that we worked on. But with hepatitis A, the most important message would be that it is a vaccine preventable illness.
Right.
And we do offer the vaccine at the health department.
Let's talk, because the time always goes so fast on these shows, and we never, we get scattered, and all of a sudden I'm thinking, oh my God, I didn't even ask that. People want to stay healthy. School, parents send their kids to school. They want them to be healthy. What is the most basic? Yeah, tell us how you can, the best way to stay healthy. What can you do to prevent illness of any type?
It's a great question, and it's an easy answer. Number one is you need to always have clean hands. You do not want to introduce virus or disease into your body.
Right.
And by doing that, by assuring that that does happen, is wash your hands often with soap and water.
Now, when you say often, are we talking 20 times a day, or are we talking 4 times a day?
After you eat, after you use the restroom, primarily if we're talking about kids, it's after restroom, after eating,
Well, what
or
about
before eating and after sometimes.
What about, now I've heard
Okay.
that paper can, if you're secretaries in our office, those kinds of things that touch paper from everywhere.
Yeah.
What about that? I mean, can that contain disease or illness? Should we wash our hands after we
Yeah.
do our work like that?
Virus and bacteria could be everywhere.
Okay.
And
Okay.
on anything.
Right.
So we just have to be cognizant. I mean, we touch stuff, but what we have to make sure is the virus and disease, it needs to be introduced into your body.
Okay.
So by
So
touching your face and getting
Right.
getting into your mouth, your nose, or your eyes, that's what we don't want to happen, because then
Exactly.
it's introduced into your body.
So it's not just touching it and having it on your hands. It's as if you touch it, have it on your hands, and scratch your nose, or
You wear
rub your
contact. I
eye.
mean, it can be anything.
Right, right.
On average, I'm sure every person touches their face 50, 60 times a day at least, if not twice that.
Well, and none of us think that.
Right.
I mean, I heard that the other day, and I was like, "There's no way I touch my," and then when I started paying attention, it was like,
Yeah.
now, what about hot water versus cold water?
Hot water is always better. Now, what we would teach, whether it's our school health nurses or other employees that we have to promote wellness, is when you're washing your hands, sometimes they say, sing happy birthday twice. So
I heard that on
So for
FBR,
20
yeah. Right.
20 seconds,
For
you're
20
washing your
seconds.
hands.
Okay.
Now, if you don't have soap and water, as long as you have a sanitizer with at least 60% alcohol in it, and not many people probably read the ingredients, and most of them are at least 60%.
Like
but that's
Purell, for
right.
example. I'm not,
Promoting one over the other.
promoting Purell, but I mean, so
Yeah.
look at the label. If it's got 60% or more alcohol, you're good. That should help you.
Correct.
Is one better than the other?
As far as hand washing
Yeah.
versus the sanitizer, yes, hand washing with soap and water would be preferable over the sanitizer.
Really?
Yes,
Okay.
and sanitizer is a great backup if running water or soap is not available.
Okay. Now, and when we wash, again, we're doing basic stuff, but it's important. Do we go up to here or just this? I mean,
I
what?
actually learned the WHO, if I may quote
Yeah.
it, where you go back and forth. You want to make sure you wash the back of your hands
Right.
as well. And then you also want to make sure that you are scrubbing underneath your nails. They also say cupping, which you can go like this. Wash your thumbs. So you really just want to
Wow.
make sure you're getting in every single crevice of your hands. And that 20 seconds or singing happy birthday twice will give you enough time with the contact with the soap.
So we should have a nail brush when we wash our hands. I mean, ideally.
If you're a physician and a surgeon, absolutely.
Right.
Yeah.
Okay. Okay. And what?
Eat healthy. I mean,
Yes.
we
Sure.
know that it's hard. Sometimes you need to be very disciplined. We're all very busy.
Right.
You know, if you're a parent and you have kids and you're running from place to place, and fast food is always available. And,
Right.
and typically, you know, when we do research on it, money is one area, and it's definitely a concern, but the bigger issue always tends to be time.
Yeah.
I don't
Yeah.
always have time, so you just need to be disciplined. And I know I can still learn, and we all can learn about that, but it's eating healthy, it's increasing physical activity,
Sure.
Yes.
which is absolutely critical. It's something we all should be doing.
Right. And what about rest, sleep?
What's that? I wake up tired.
Yeah.
But
Yeah, well,
it's in all honesty, it's extremely important.
okay.
It really is.
Okay.
And the recommended number of hours of sleep I don't have off the top of my head, but I mean, the younger you are, your body needs to rest and to recoup
Really?
and to grow.
So the older
Yes.
you are, you don't need as much rest? Really? That's interesting. Supposedly,
Yes.
huh? Oh, wow. Okay. So for parents that are watching, if they have school-age children and they're sleeping 10 hours a day, that's okay. Don't, you know. Now, obviously, if you can't get them out of bed to go to school, that's a different thing. But I mean, sleeping,
I believe it's between 8 and 10 hours.
and that's the recommended time?
Yes.
Okay. Okay. What else? Anything else that we can tell people to do to protect them? And
Now, from a public health perspective, and we touched on it before, is with immunizations.
Right.
You know, if you're sick, go to your doctor. You know,
Right.
that's number one. You know,
Right.
if you feel that you're not feeling well, call up your physician. If you don't have a physician, you can always reach out to us at the health department. There's also the
to
Florida
get
Community Health
a
Center.
flu shot or whatever.
Yeah.
Right. And you know, it's funny because and we're talking generically about the flu, but you know, so often I hear people say, "Oh no, I don't get a flu shot. It's going to make me sick and give me the flu. I'm not going to do it."
Yeah.
But they're missing the boat, aren't they? Immunizations, whether it's Hep A, the flu, shingles,
Yeah.
you know, they're good, aren't they?
You're on top of it. I
Right.
mean, what we can tell you is influenza, it's a vaccine preventable disease.
Right.
In St. Lucie County, you know, one thing that we always do is monitor disease. So
Right.
we establish baselines of every disease, so we know if there's a fluctuation of
Oh, I see. And
one
that's when you
virus
come in.
or
Yeah.
another
Right,
virus.
right.
So with influenza, I can tell you the past 20 years that we average anywhere from 30 to 40 fatalities in St. Lucie County from influenza or pneumonia.
Right.
And it's
So, and it's
get your flu shot.
Yeah, yeah, right. Go and we're almost out of time. Again, the health. Give the viewers the number one last time, so we.
Our numbers, it's area code 772-462-3800.
So if
Follow the prompts. It's very user friendly.
Sure, sure, and they can, if you've got a question or want to come in or now can people just drop in?
They can.
Okay, they may have to wait longer. It's better if you have an appointment.
Yeah. I
Yeah,
mean, it
obviously.
usually is.
Right. Okay. Oh no, this is great, and I do want to give a big shout out to your department because I've seen all the great work you've done to keep our community safe and healthy and you know alive. So thank you for all you do for all of us.
Thank you.
Thank you.